Welcome to this video on two major adrenal disorder, that is Cushing syndrome and Addison disease. These conditions arise from hormonal imbalances in the adrenal glands, small but powerful organs that sit on the top of each kidney. They produce crucial hormones like cortisol and aldosterone, which helps regulate metabolism, stress, blood pressure, and fluid balance. Each gland has two parts, the adrenal cortex and the adrenal medulla. The adrenal cortex, which produces cortisol, the body's main stress hormone, aldosterone, which regulates sodium, potassium, and blood pressure, and androgens involved in growth and sexual development. The adrenal medulla produces epinephrine or non-epinephrine, key players in body's fight or flight response. Disorders occurs when these hormones are either overproduced as in Cushing syndrome or underproduced as in Addison disease. Here comes a question that what led it to cause in person's body. So here are the causes, that is external sources like long use of corticosteroid medications, example prednisone or dexamethasone, often prescribed for asthma, lupus or other organ transplants. Internal causes like pituitary adenomas producing excess ACTH, adrenal tumors, or ectopic ACTH producing tumors in the lungs or pancreas. Due to numerous causes, that hypothalamus stresses to release corticotropin releasing hormone, which prompts the anterior pituitary to secrete ACTH, that is adrenocorticotropic hormone, that stimulates the adrenal gland to produce cortisol. Cortisol leads to effects such as increased gluconeogenesis, protein and fat mobilization, and anti-inflammatory responses. Prolonged elevation may cause clinical features like hyperglycemia, muscle wasting, central obesity, moon phase, and immune suppression. Now let's come to the symptoms, that is rapid weight gain, especially in the trunk, while legs and arms remain thin. Moon phase, a round, puffy appearance of the face. Buffalo hump, a fat pad between the shoulders. High blood sugar, sometimes leading to diabetes. Purple stretch marks, thin skin, easy bruising and acne. Muscle weakness, back pain and osteoporosis. In women, excess facial hair, irregular periods, and reduced libido-like symptoms were seen. For diagnosis of the patient with the Cushing disease, we will see the midnight salivary cortisol test, dexamethasone suppression test, 24-hour urine cortisol measurement, and plasma ACTH levels, which are usually high, that is to 9 to 52 picogram per ml. After diagnosing, we'll come to the management of the patient with the Cushing disease, that is medications to lower cortisol level such as ketoconazole, mifepristone or metotone, surgical removal of the tumors via transsphenoidal surgery or adrenalectomy. After surgery, lifelong steroid replacement may be needed if both adrenal glands are removed. Patient carry a steroid alert card and follow sick day rules, doubling their dose during illness or stress. Now comes to the part of the nursing care of the patient with the Cushing disease. Firstly, we will do the nursing assessment regarding vital signs, physical changes, edema because the patient is very fatty, then fluid volume overload, abdominal assessment, lab values, and then we will think about the things like fluid and electrolyte balance is maintained, nutritional needs are maintained, in which we will see the low carbs help manage hyperglycemia, low sodium helps to prevent fluid retention and hypertension, high potassium corrects hypokalemia and a common issues in Cushing syndrome. Self body image and esteem is improved, comfort is promoted, in which we can see for the signs of the fall, and another one like we will provide the comfort to the patient by elevated their limb levels, then help prevented infection occurrence. Now comes to the other hormonal part of the disease, that is Addison disease, in which too little cortisol is produced. Addison disease is the opposite problem. It results from insufficient production of cortisol and aldosterone. When we will come to the causes of the disease with the Addison disease, here are two causes like primary Addison disease, which is often autoimmune destruction of the adrenal glands like tuberculosis, cancer or surgery. Then second one is secondary Addison disease, which is due to pituitary damage, tumors or stopping steroids abruptly. So here comes that how it happens in human body. In this, the brain does not send enough signals to ACTH, that is adrenocorticotropin hormone, to the adrenal glands. When cortisol level is low, the body cannot make enough sugar for energy, and even they are not using fats and proteins properly and become more sensitive to infections and stress. If the aldosterone is also low, the body loses too much of salt and holds too much of potassium, which can ultimately lower the blood pressure and causes problem with body salts and electrolytes. Because of the hormone problems, the person may feel very tired and have low blood pressure, lose weight and develop darkening of the skin, that is hyperpigmentation, what we will discuss in the symptoms part 2. Now comes to the symptoms part like chronic fatigue, weight loss and muscle weakness will be seen. As we have already discussed in the pathophysiology that low blood pressure, especially when patient is standing, that is the type of orthostatic hypotension will be seen. Salt cravings, nausea and vomiting, hyperpigmentation, a darkening of skin especially in joints and scars, hyponatremia, that is low sodium, hyperkalemia, that is high potassium, and acidosis. Diagnosis for Addison disease involves blood tests showing low cortisol, low sodium and high potassium, ACTH stimulation test to assess adrenal function, imaging to detect adrenal or pituitary abnormalities. After learning the diagnosis, let's come to the key management given to the patient. Glucocorticoid replacement, hydrocortisone or prednisone can be given. Mineral corticoid replacement, that is fluorocortisone, can be given. Optimal androgen replacement in women with DHEA can be given to the patient. So for the nursing care, firstly we will assess the patient, then the nursing interventions can be given regarding the cardiac status of the patient, then fluid status of the patient education regarding stress reduction, high proteins and carbs diet, medical management regarding prednisone, hydrocortisone can be given to the patient. Important care tips include watch for Addison crisis, which includes vomiting, very low blood pressure and loss of consciousness. Teach the patients to take medications regularly, use emergency steroids when needed. Encourage the patient to drink enough of fluids with high salt diet. After learning two conditions, now the question arises, what is the difference? The difference is between their hormonal level. In Cushing, the cortisol is very high, and in Addison, the cortisol is low. For the sign and symptoms, the Cushing patient is with moon phase, obesity, high BP. for Addison, the patient is weight loss, low BP, and fatigue. Then management will also be different for both the cases. Both the disorders are serious but manageable with very early diagnosis and proper treatment and patient education. If you are taking steroid medications, never stop them suddenly. Always follow your healthcare provider's instruction. Wear a medical ID, carry emergency steroids, and attend regular checkups to ensure your hormones stay in balance. With this, we end. Till then, keep learning, and thanks for your patience listening.